Yes, it is absolutely possible to stay awake during brain surgery. In fact, it is not just possible, it is often necessary. Imagine lying on an operating table, talking to your surgeon while they operate on your brain, all to ensure you can still speak, move, or even remember your loved ones after the surgery. This is not science fiction. It is the fascinating reality of awake brain surgery, a groundbreaking medical procedure that is saving lives and preserving what makes us human. Now, let's take a moment to let that sink in. Awake during brain surgery is a scenario that defies everything we think we know about surgery. A time when most of us imagine being unconscious, unaware, and completely out of the picture. But here's where the story gets even more extraordinary. Your role during this procedure is not passive. You're not just a patient. You're a partner, actively participating to guide the surgeons and help them protect what's most important: your ability to live a full, meaningful life. Welcome to Science Made Easy, the channel where we uncover the most astonishing wonders of the human body and beyond. Today, we're pulling back the curtain on one of the most jaw-dropping advancements in modern medicine: awake brain surgery. Why would anyone willingly stay awake during an operation? How does it work? And perhaps most importantly, what makes this procedure a game-changer in preserving critical brain functions like speech, memory, and movement? These are the questions we'll answer today. But we won't stop there. We'll take you on a journey through the state-of-the-art technologies that make this possible. Imagine tools so advanced they can map every vital area of your brain with pinpoint accuracy, or guide surgeons as if they're navigating with GPS in real time. You'll hear the story of real-life patients, like Mark, the pianist who played his keyboard during surgery to ensure he could keep his gift alive. You'll learn what it feels like to be awake in the operating room, the incredible training surgeons undergo to perfect this procedure, and the emotional and ethical dilemmas that come with such a revolutionary practice. And let's not forget the big picture. How does this innovation reflect the resilience of the human spirit and the limitless potential of science? What are the global challenges that prevent millions from accessing this life-saving technology? By the end of this video, you'll not only understand the science but also gain a new appreciation for the bravery of the patients, the skill of the surgeons, and the ingenuity of the technology that's reshaping lives. So, if you're fascinated by the human brain, curious about the future of medicine, or simply in awe of how far science can push boundaries, this is the video for you. Don't forget to like, subscribe to Science Made Easy, and hit that notification bell so you can keep exploring the fascinating world of science with us. So, how does it all work, and why would anyone choose to stay awake for such a procedure? Let's find out. Awake brain surgery, or awake craniotomy, might sound like something out of a medical drama, but it is a real and vital procedure. Unlike traditional brain surgery, where patients are put under general anesthesia, awake craniotomy keeps the patient conscious throughout the operation. This allows surgeons to perform incredibly precise procedures while ensuring that crucial brain functions, such as speech, motor skills, and memory, are preserved. The patient remains awake, so doctors can monitor and interact with them, making sure they avoid harming areas of the brain responsible for these essential functions. For many patients, this surgery is a game-changer, offering the chance to recover without losing vital cognitive abilities. And for some, it may even be the difference between life and maintaining the quality of life. To truly understand the value of this remarkable procedure, we need to look at the advanced technology that makes awake brain surgery possible. One of the most essential tools used by surgeons is functional magnetic resonance imaging, fMRI. This imaging technique enables doctors to map out the brain in extreme detail before even touching the scalp. fMRI helps doctors identify which areas of the brain are responsible for critical functions like speaking, moving, and remembering. It essentially acts as a brain blueprint, giving surgeons a roadmap of which areas they can safely work on and which parts they need to avoid. By creating a detailed map, the doctors are able to plan the surgery in advance, drastically reducing the risk of accidentally damaging important regions of the brain. But fMRI is just one part of the puzzle. Another powerful tool used in awake brain surgery is intraoperative brain mapping. This technique involves stimulating specific areas of the brain with small electrical currents while the patient is awake. Surgeons do this to see firsthand which parts of the brain control critical functions like motor skills or language. When an electrical current is applied to a particular brain area, the patient might be asked to perform a task, such as speaking or moving a hand. If the patient struggles with these tasks, the surgeon knows they're working in an area that controls a vital function. This real-time feedback ensures that surgeons can fine-tune their approach during the surgery, making it far more precise and minimizing the risk of impairing crucial brain functions. These two technologies work together to ensure that awake brain surgery is as safe and effective as possible. By using both fMRI and intraoperative brain mapping, surgeons can perform highly intricate procedures with a level of precision that would be nearly impossible with the patient under general anesthesia. This allows them to remove brain tumors, treat epilepsy, and address other conditions that might otherwise be too risky to operate on without causing severe side effects. For many patients, it's a chance to take back control over their lives, all while staying awake to ensure they're actively participating in the preservation of their brain functions. Then there's neuronavigation, often described as GPS for the brain. This technology combines MRI data with real-time imaging to guide surgeons to the exact location of the tumor or damaged tissue while avoiding healthy areas. The precision offered by these technologies means surgeons can operate with confidence, knowing they are minimizing risks to the patient. For patients, these advancements mean better outcomes and faster recoveries. It's incredible to think that what was once a high-risk, invasive procedure is now a carefully orchestrated dance between human skill and cutting-edge technology. Let's take a closer look at what it feels like to undergo awake brain surgery and what comes after. For most patients, the idea of being awake during surgery can be daunting. Imagine hearing the sounds of surgical tools and seeing the medical team bustling around you while knowing they are working on your brain. However, the actual experience is often described as surprisingly calm. Thanks to local anesthesia, patients do not feel pain. The brain itself lacks pain receptors, so there is no sensation when the surgeon is working on it. Take the story of Mark, a 45-year-old pianist who had a tumor near the motor cortex, the area controlling fine finger movements. During the surgery, he was asked to play a keyboard while the team worked. This real-time feedback ensured they could remove the tumor without affecting his ability to play music. Post-surgery, Mark was not only tumor-free but also able to return to his career. Recovery after awake brain surgery can vary widely from patient to patient, depending on the complexity of the case and the specific part of the brain that was operated on. Some patients are able to return to their regular routines within just a few weeks, resuming work or daily activities with minimal disruption. However, others may require more extensive rehabilitation, with some spending several months in physical or occupational therapy to regain strength and mobility. These therapies are crucial for helping patients rebuild their physical abilities and adjust to any changes caused by the surgery. For patients whose speech is impacted, speech therapy becomes an essential part of the recovery process. In many cases, speech therapy can be truly life-changing, helping patients regain the ability to communicate effectively and re-engage with their communities. A significant emotional theme that runs through the recovery process is a sense of empowerment. Many patients feel a strong sense of ownership over their recovery, as they were actively involved in ensuring that the critical areas of their brain remained intact during the surgery. This awareness can lead to a renewed appreciation for life and a deeper understanding of the body's resilience. There's something incredibly powerful about knowing that your own consciousness and participation during the surgery played a role in the outcome. This sense of agency is often a cornerstone of recovery, as patients move forward with a renewed sense of hope and determination. However, the emotional and ethical aspects of awake brain surgery are just as complex as the procedure itself. For medical teams, performing these surgeries requires more than just technical expertise. Surgeons, anesthesiologists, and other healthcare professionals need to communicate clearly with the patient, establish trust, and provide a sense of comfort throughout the process. This requires a deep level of empathy, as patients must be guided through what can be a very intimidating and emotionally charged experience. The ability to keep the patient calm and informed, while simultaneously ensuring the surgery goes smoothly, is a delicate balancing act that involves both skill and compassion. Culturally, the idea of awake brain surgery is met with varying reactions depending on the region and local medical practices. In countries with advanced medical systems, awake craniotomy is often viewed as a cutting-edge procedure that highlights the significant strides made in modern medicine. It is a testament to the advances in both technology and surgical practices that allow doctors to operate on the brain with unparalleled precision while keeping the patient conscious. On the other hand, in some parts of the world, the concept of staying awake during a major surgery might evoke fear, skepticism, or even distrust. For many, the idea of being awake while doctors are operating on their brain feels unnatural, and the fear of pain or complications can overshadow the potential benefits. Another important ethical consideration is the access to this procedure across different parts of the world. In low-resource settings, there may be a lack of specialized equipment, trained personnel, or both, making it difficult or even impossible for patients to undergo awake brain surgery, even though it might save their lives. This disparity in healthcare access raises difficult questions about equity in medicine. Why should a potentially life-saving procedure like this only be available to those in wealthier countries or regions with advanced medical systems? How can we bridge the gap to ensure that people in underprivileged areas have the same opportunities for life-saving treatments, regardless of where they live or their economic status? The disparity in access to such sophisticated procedures calls attention to the broader issue of global healthcare equity and the need for systemic improvements in healthcare delivery worldwide. Awake brain surgery is not just a medical procedure. It is a finely tuned art that demands years of specialized training and experience. Surgeons in this field don't just learn how to operate. They master the intricate choreography of precision and communication. Rigorous education includes hands-on simulations and close mentorship under seasoned professionals. These simulations mimic the complexities of real surgeries, providing a risk-free environment where trainees can hone their techniques and build confidence. In recent years, advanced technologies like virtual reality have revolutionized surgical training. With VR simulations, medical trainees can practice everything from delicate incisions to navigating challenging scenarios, all without ever stepping into an operating room. These immersive tools help refine their technical skills and sharpen decision-making abilities, ensuring they are prepared for the real thing. But becoming an expert in awake brain surgery is not just about surgical finesse. Emotional intelligence is equally crucial. Surgeons are trained to communicate effectively with their awake patients during procedures, creating an atmosphere of trust and calm. This ability to keep patients engaged and reassured is what separates good surgeons from exceptional ones. It's not just about removing a tumor or repairing damage. It's about guiding the patient through a life-altering experience with empathy and care. The dedication behind this training is inspiring. It ensures that the next generation of neurosurgeons is equipped to tackle increasingly complex challenges, continually pushing the boundaries of what is possible in medicine. These surgeons are not only saving lives, they are preserving the qualities that make life meaningful for their patients. Undergoing awake brain surgery is as much a psychological journey as it is a medical one. Many patients describe feeling a deep connection with their surgical team during the procedure. Being awake and actively participating creates a unique bond, fostering a sense of partnership and trust. For many, this collaboration is a source of empowerment. They're not just bystanders in their care. They're co-navigators in a complex and delicate process. However, the aftermath of such an intense experience can be equally profound. While some patients emerge with a newfound appreciation for life, others may face psychological hurdles like anxiety or even post-traumatic stress. This underscores the importance of comprehensive pre- and post-operative support, ensuring patients are cared for emotionally as well as physically. Psychological counseling and support networks are invaluable in helping patients navigate this duality. Patient advocacy groups have played a transformative role in raising awareness about awake brain surgery. These organizations provide essential resources, from educational materials to financial assistance, that help patients make informed decisions. Their work has demystified the procedure, empowering individuals to see it not as a last resort but as a viable and potentially life-saving option. The future of awake brain surgery is brimming with potential thanks to rapidly evolving technology. Artificial intelligence is already making waves in the field, offering unprecedented capabilities for analyzing brain imaging data with speed and precision. This allows for even more accurate surgical planning, minimizing risks and maximizing outcomes. Looking ahead, the integration of robotics with human expertise holds the potential to revolutionize awake brain surgery in ways we're only beginning to grasp. Picture a surgical suite where robotic assistants work seamlessly alongside human surgeons, each leveraging their strengths. These advanced machines could handle the most delicate and intricate tasks, such as precisely targeting tiny areas of the brain or steadying surgical instruments to minimize hand tremors. Meanwhile, surgeons would focus on making critical, high-level decisions and maintaining communication with the awake patient. This collaboration could not only enhance the precision of the procedure but also reduce the likelihood of complications, leading to better outcomes for patients. Beyond safety, robotics could significantly increase the efficiency of these surgeries, potentially shortening operation times and allowing medical teams to treat more patients in less time. Most importantly, this synergy between human and robotic expertise could help democratize access to awake brain surgery. By making it safer, faster, and more standardized, healthcare systems in underserved regions could adopt this cutting-edge procedure more easily. The fusion of human intuition with machine accuracy isn't just a glimpse into the future. It's a promise of a new era in medical innovation. What are your thoughts on awake brain surgery? Would you ever consider staying awake during such a procedure? Drop your thoughts in the comments below. I'd love to hear what you think. If you're fascinated by the human brain, be sure to check out our other videos, like advancements in neuroscience or the brain's remarkable ability to recover after injury. Don't forget to like this video, subscribe to the channel, and click the notification bell so you never miss an update.